Today, the federal government moving closer to making everyone 18 and older eligible for booster shots. It's a big move and comes just ahead of the real start of the holiday season.
Joining us for a look at what this means is Dr. Sandra Nelson, an infectious disease specialist at MGH. Dr. Nelson, thanks for your time.
Thanks so much for having me.
So, Dr. Nelson, this has been a pretty heated debate even among federal health advisors. So what are the concerns here?
You know, while this has really been heavily debated, I do think it's important to note that today, when the expert advisory panel to the CDC voted, that vote was actually unanimous in support of vaccination for all of those who are over the age of 18. You know, the main points of contention have been, first, really understanding whether additional booster doses are both necessary and safe for those who are, specifically for those who are lower risk of of complications from the disease. I think the other concern is that it has diverted some attention away from really the primary objective, which has been to get vaccines to those who are unvaccinated. But over the last several months, we really have learned that immunity against symptomatic infection is waning. And whereas the protection was very high early after vaccination, it is a little bit lower as we get months out, in the order of 60 to 70% for those who are 6 months out from their vaccine series.
All right. So
and we know that the numbers of individuals in the United States, over 30 million, that have already received a booster dose, the booster dose is really just as safe as the initial series.
So, Dr. Nelson, the move does put tens of millions of healthy Americans now in the pool for booster shots. So how quickly would you recommend that folks go and get those shots, especially if, say, they're young, maybe 20s, 30s, 40s, and have no other complicating health factors?
You know, I think for most adults, there's really no tremendous urgency to getting that booster dose. I think it's really important to acknowledge that even though the vaccine effectiveness against any symptomatic infection is a little bit lower than it was, it remains highly protective against severe disease and hospitalization and death. So I think the real concern are for those who are at higher risk to go out and get their booster doses. They should do that sooner rather than later, particularly those who are over the age of 65 or have other underlying medical conditions that put them at higher risk. And then, of course, getting to vaccines to those who haven't gotten them yet at all. But for those who are healthy, young, without complications, I think that waiting a little bit is just fine.
Well, and Dr. Nelson, Dr. Fauci has been pretty clear, even pretty direct in recent days about the need for this move. You've been talking about it. He's been citing the waning immunity. The concern is it potentially another surge, I suppose? We do see that the numbers are going up. What are your concerns in terms of that?
You know, I do share that concern. I think that there are a number of signals that suggest that we might be seeing either a surge or perhaps a strong wave in the months ahead. You know, not only are we seeing waning immunity, but the environmental circumstances that promote transmission are increasing. Things like increasing travel as we approach the holiday season. And for those of us who live in northern climates, we're spending a lot more time indoors, which really favors transmission. So for all of those reasons, I do think that there is a risk that the number of cases we're going to see goes up. Certainly, we hope that does not lead to more hospitalizations and deaths. I think the other thing that I'd like to highlight is we're also seeing an uptick in influenza. And given that both are going to be circulating in this winter at the same time, that could really put challenges for the healthcare system if we see outbreaks and surges at both at the same time. So when we're talking about COVID boosters, let's also remember to just get our flu shots for this year.
A good reminder. Dr. Sandra Nelson, an infectious disease specialist at MGH. Thanks for your time. Have a good weekend.
Thanks so much.